There are four valves in the heart, and the aortic valve is the outlet from the left ventricle. All of the blood that your heart is pumping to your body has to go through the aortic valve. And two things can go wrong with a valve. It can either leak or it can become narrowed. And aortic insufficiency or aortic regurgitation is a diagnosis that means a leaky aortic valve. Most patients with leaky aortic valves have a valve that was abnormal from birth, but there are other processes, including infections and trauma, that can cause an aortic valve to leak. If you have aortic insufficiency, what that means is that some portion of the blood that your heart pumps with each beat leaks back into the heart through the leaky valve. And therefore, in order to provide enough blood flow to your body, your heart has to compensate for that by pumping a higher than normal amount of blood in order to make up for what leaks back into the heart. And it can do that in two ways. It can either beat faster, which is not particularly good for the heart, or it can pump more with each beat by enlarging and pumping a higher volume. And that too is working harder than it would normally. Now, there's a great deal of reserve capacity built into your heart, as there is in all of your body systems. So for quite a while, your heart may be able to compensate for the leaky valve, and particularly if that leak is not severe. But over time, a leaky valve tends to leak more. And as the heart enlarges, the valve tends to leak more as well. And after a certain point, the enlargement of the heart further enlargement of the heart is no longer possible, and the heart begins to fail. At that point, the process is to a large extent irreversible, and you may be looking at something as severe as a heart transplant in order to recover. And therefore, we recommend that if the leak is bad enough, and if the heart, and particularly if the heart is showing any signs of decompensation, that valve be treated. And recently, it's been shown that waiting until you have symptoms, and the symptoms may be as mild as a little bit of shortness of breath or a little bit of fatigue, but even that degree of symptom means that things are pretty far down the road and that your heart is already starting to fail, and that your results of surgery at that point are not going to be as good as if we had intervened earlier. And that's why with aortic insufficiency, as with most heart valve diseases, we will want to follow you with echocardiograms to determine when the best time to operate is going to be.